Thank you for joining us on this edition of Ethnic Health America. We're talking about children's health. We'll talk about the health of infants in our first segment with Doris Gee. Doris Gee is a child health associate, and we thank you for joining us.
Thank you, Dr. Miller.
Tell us a little bit about your journey to medicine and specifically how you selected to be a child health associate.
Well, starting back at high school, I knew I wanted to do something in the sciences, but not sure. And when I was in college, I knew something in medicine was my calling. So, you have the traditional nurse, physician, and when I came across this brochure about physician's assistants taking care of children, I knew that was the program for me. And so this program that I entered in at the University of Colorado Medical School was a PA program exclusively training you to take care of children in the pediatrician's office. And so this program will train you for 3 years, starting from infancy to training you in all the things that a pediatrician would see in an outpatient setting.
What's the difference between a physician's assistant and a pediatrician?
A pediatrician takes 11 years to train from high school to becoming a pediatrician MD, and it takes a PA half the time. So my specialty would be only pretty much in the outpatient setting, and our training is fairly extensive so that most of the problems we're able to handle by ourselves. But of course, if there's something fairly serious or we're not sure, then we would consult with the pediatricians. And as PAs, we have more time to spend with patients and do more patient education, which is what patients like.
Why did you select pediatrics?
I like pediatrics because it's dynamic and you have a chance to spend a long time with the child and see them develop from infant to adolescent. And I've been in practice for almost 30 years now, so I have a lot of my patients now having their own children, so it's very rewarding.
Tell us a little bit about some of the special services that you need for new parents, or even repeating parents often need more support, and tell us what that support is like for the average parent in the first year.
The first year or two of life is a very dynamic year for kids. They grow so fast and their development changes very fast, so that what happens at newborn and then what happens a couple months later is totally different. So that's why having your child come in for health care fairly often is important, in addition to all the immunizations they'll get. Most of the pediatric practices time their immunization schedules with how often the parents come in, because you want to make sure that your patients are getting all the immunizations and getting checked frequently in the first couple of years, just to make sure that there are no developmental problems or any other physical problems that may be appearing or may be very subtle that you wouldn't pick up otherwise.
What is your philosophy on breastfeeding, and how much support, and what type of support will you give for that?
The American Academy of Pediatrics and our practice, we recommend parents, that moms do breastfeed, and we recommend that they try to breastfeed at least through the first year of life. And to that, we consider the mom and the baby like a breastfeeding couple. So we have to support the mom as much as we do, making sure that we see the infant also. And then we have to make it easy for her and make sure that she feels comfortable. There's a lactation consultant. You want to make sure she eats right. You want to make sure that there is help at home so she doesn't get overstressed. And so it really involves her family, and also, if needed, some medical professionals consult if they're having specific problems with breastfeeding.
Just some of the issues that come up in the first year of life beyond the kind of well-child things, things like constipation or virus. What do you see most frequently?
The most frequent thing we do see are colds or upper respiratory infections, and then the other thing would be just dermatological things, rashes. Kids get rashes fairly often. And then the other thing is my child normal? So when you come in for the well baby visit, parents are concerned that if their baby is not doing something or something is unusual, we get those questions fairly often.
What about immunizations? A lot of parents are concerned about immunizations, concerned that they know they're helpful, but they're concerned about issues. What does the research and the data say about immunizations?
By the time a child is 2, they received over 25 immunizations, and some parents are concerned that their baby cannot handle, or their immune system can't handle all these immunizations. But that's not true. The infants have a great capacity with their immune system to handle all the immunizations and other viruses and colds and things that are around in the world. So the minute they're born, from a sterile environment, they come out and there's all sorts of bacteria and viruses, and their bodies are able to handle it. And so a lot of parents want to space out the immunizations, but the studies have shown that's not necessary, that your infant can handle like the 4 or 5 immunizations they get at 2, 4, and 6 months.
One of the biggest concerns, and we'll certainly address this a little later in our program, is this whole issue of obesity in children. What are we suggesting for children, infants in the first? We know that what you feed an infant has a lot to do with what happens to that infant in terms of his diet and his growth after that. Tell us a little bit about what you recommend. How do we go from breastfeeding to solid foods? What are your recommendations about feeding?
Again, the breastfeeding should be for the first year, and then a very slow introduction of food singly at each, every 3 or 4 days. And then when kids are older, not using food as a reward, so that if they, do something correct, there should be some alternative methods rather than feeding something, that's high in calories or sodas or fast foods. And so part of that education process does begin at the end of the first year when your child is moving on to, adult solid foods, and beginning to work with that family to make right choices. And then as they get older, kids in, school age, middle school, high school, they have more choices on their own. So, again, going over with them exercise, limiting the amount of TV, selecting foods that are low in calorie, all those would help in terms of, curbing the obesity.
Well, Doris, you certainly seem to enjoy what you do, and we enjoy having you here in the practice. We've been together probably the longest in the service of children. What do you take with you as you go through this experience in a very short period of time? What's the most rewarding thing?
I think the most rewarding thing is seeing the families and the children grow up and seeing what they do when they become young adults, and see what happens to them, whether they go to work or go to college, and seeing the families evolve. So I think that's really been the most satisfying in the 30 years that we worked together.
All right, well, thank you very much. We'll be right back after this break to discuss adolescent health.